Guys, welcome to Pajon Imaging Hall. In today's patient and public education series, we look at why you have to do chest X-ray most of the cases before undergoing surgery. Why you are asked to do chest X-ray before surgery, what we call a preoperative chest X-ray. What are the reasons? Please remember to subscribe to this channel so that you'll be notified when new video is released. Thank you. Welcome back. Why do your clinician ask you or the surgeon ask you to do chest X-ray for some of the surgery cases? Uh, Chest X-ray is a vital diagnosis test that carries a lot of information. In fact, in radiology department, chest X-ray is the most requested radiology investigation. And most of the patients going for surgery are requested to take chest X-ray for the following reason. One is to assess the heart and the lung condition. With chest X-ray, we can see the lungs and the heart, so we can assess their condition. Now, this is the lungs, the dark area. Find out whether there are issues like infection in the lungs or pneumonia in the lung or collapse. We've treated collapse, whether there is collapse in the lung or some pathologies that may pose a risk during surgery. So with chest X-ray, we can easily see the lungs. I remember the lungs is very important organ in the body. It's a vital structure because the oxygen need of the body is supplied from the lungs. So if the lung is not in good condition, then it can affect the surgery. So we'll look at these things to know whether there is a condition in the lung that can pose a risk during surgery. Also, chronic conditions, some issues that the patient have had for a long time may need a special consideration during surgery. It may need that the patient may be, they may shift the surgery or have some drugs available or modify some drug that may be given to the patient. Or we'll look at the heart condition also. We can see the heart in the chest X-ray. This is the heart, this structure at the middle is the heart. So we can know when there is a cardiomegaly, if the heart is enlarged, or if there are pathologies there, we can know. If there is pulmonary edema, we can know. So we can be able to know, to rule out cases of heart failure and other. Then if these things are there, just as we stated in the condition of the lung, it can pose risk for the surgery, and it can equally be considered in the surgery when we know what the heart is like, whether there are pathologies there, then they can modify some certain things during the surgery. The second reason why we do chest X-ray before surgery is to identify potential complications like pre-existing conditions, things that are already known. Now, the second reason why we do chest X-ray before surgery is issue of complication. We want to run away from complications. So chest X-ray can help us to identify potential complications like pre-existing conditions and undiagnosed diseases. So we'll be able to see them in chest X-ray to know whether the condition can increase the risk of complication during or after surgery. And previously unknown diseases like TB or lung cancer, which we may not know that the patient have, may be addressed before the surgery if the patient undergo chest X-ray, which will review this undiagnosed condition before. So then the third one is it guides surgical decisions. Like we can decide to delay the surgery based on the X-ray findings. The surgeon might adjust the surgical approach if the X-ray reveals a significant problem like active infection or severe heart failure. The surgeon may decide to delay the surgery and treat the condition they are seeing in the chest X-ray so that the patient can improve and be able to withstand the surgery. Then also the surgeon can modify the surgical plan based on the X-ray findings. The surgeon might adjust the surgical approach, or even the anesthetist. They can adjust the dosage or the kind of anesthesia they're going to give to the patient based on the finding on the um, chest X-ray. The fourth one is monitoring post-surgery. The X-ray you do before surgery help you to have a kind of comparison after surgery, because after most cases also after surgery there is a need to do another chest X-ray. So that chest X-ray you do after surgery is now become useful if you know the state of the heart or the chest X-ray. If you know the state of the heart and the lung or the chest before the surgery. So the one we do before surgery helps for better use of the one we do after surgery. The two chest X-ray can now be compared for a better result. Please like, share, and subscribe to this channel. Bye for now.